Hi, my name is Kaylin Lee,
And I'm Seraphine Park.
and today we're going to be talking about how racism affects mental health in teenagers.
For our contents of this presentation, we'll be talking about the project theme, the project benefits, the importance of the project theme, the education, data, and evaluation, as well as the evaluation plan.
So, for the selection of the project theme, racism is an occurring problem in society today, and that is why me and Sarah chose to talk about the effects of racism among teenagers. A lot of people think that racism is simply just a hurtful joke that can have some consequences, but it does lead to serious mental health issues. It is important for society to understand the detrimental effects of being racist and how harmful it can be to teenagers. As both me and Seraphine are Asian and of immigrant families, we have both encountered various jokes about our culture and ethnicity as well. Specifically, when we would bring our lunch and we had different types of food, and we also had a lot of comments about our facial features and certain aspects we had a face. Throughout our childhood, it was confusing to receive such comments when they are simply labeled as harmless jokes. Looking back, they were certainly not humorous because we never laughed at them. This caused both of us to realize how much of an impact racism has on mental health and led us to question what can be done to combat this issue.
The benefits of this project include learning about the effects of racism can be crucial and helpful in our future as health professionals as we both want to pursue a career in medicine. It helps us become more mature and become more aware. We can become mindful of what is said and realize when something may upset someone through social cues and reactions. Racist jokes and stereotypes have become heavily normalized in this society, and it is important to recognize and remember how jokes and comments could affect patients' emotional and mental health. Developing social awareness and being mindful of what is being said can help us become the best health professionals we can be in the future. A scenario for this could include a doctor making an assumption and making a stereotypical comment to a patient. This can become offended and hurt by the remarks from the doctor. This would cause the patients to stop coming to the doctor and develop a negative outlook towards them.
So, the importance of the theme is that teens in this generation typically speak without thinking and not knowing the deeper meaning behind their words. It is common for teens to comment about other races due to not being educated about topics such as cultural diversity. Most think that it is just simply a funny joke, and their actions and just go along with the actions that their peers do. However, this is not how the recipient feels. It is vital for teens to understand that their words have power and meaning, even if it is portrayed as a joke. The recipient may try to laugh and not seem hurt, but they will feel hurt and feel looked down upon and made fun of for being themselves. Although people may think racism only affects those who are directly targeted, it actually affects the whole community.
For some effects of racism towards people could include psychological distress, substance abuse, increases in risk of PTSD, depression, anxiety, anger, lower self-esteem, as well as shame. Words have a significant impact on mental health, and when it is targeted towards our root and ethnicity, it could have more of an effect. Racism can also lead to racial trauma, which is the cumulative effects of racism on an individual's mental and physical health. It can also have physical effects, such as high blood pressure, towards people.
So, some data and evaluation. We have culture and competence of healthcare providers likely contributes to underdiagnosis and or misdiagnosis of mental illnesses in BIPOC. Language differences between patient and provider, stigma of mental illness among BIPOC, and cultural presentation of symptoms are some of the many barriers to care that explain these errors in the diagnostic process. So a BIPOC stands for Black, Indigenous, and People of Color. So this is pretty much saying that those healthcare providers will likely not be able to diagnose or misdiagnose people of these that are Black, Indigenous, and people of color with different mental illnesses. And Native and Indigenous Americans report higher rates of post-traumatic stress disorder and alcohol dependence than any other ethnic or racial group. It also passes down through generations. So this statistic shows that there are less than 3 million Native Americans in the United States. states, and out of them, 6.8% more Native Americans need treatment for their alcohol use compared to the general U.S. population. 8.2% more Native Americans need some form of substance abuse treatment compared to others, and fetal alcohol syndrome rates are as high as 2.5 per 1,000 live births within Native people.
One study found that physicians were 23% more verbally dominant and engaged in 33% less patient-centered communications with Black patients than white patients. People who identify as being two or more races are more likely to report any mental illness within the past year than any other race or ethnic group. This is shown through the statistics of any mental illnesses in the past year among adults by race and ethnicity in 2008 to 2012, as shown through white people having 19%, Black or African American people having 16.8%, American Indian or Alaska Native having 22.7%, Asian 13.4%, two or more races 24.9%, and Hispanic having 15.3%, showing that two or more races has the highest percentage as shown through that.
And next, we'll be talking about our evaluation plan.
Our evaluation plan was successful, and we created a survey for our audience to take before and after they heard our presentation. This was used to see how well they knew this topic before hearing our presentation versus after. Our results showed that overall people had a good understanding of the effects of racism on teens, but after they heard our presentation, there was 100% accuracy.
Thank you so much for listening, and remember to always be kind and reach out to your loved ones because you never know who is struggling.